Hi everyone, I'm Maggie Maloney with the Lupus Foundation of America, and we are here today at the National Institutes of Health for the 25th anniversary of Lupus Clinical Research, and we have Dr. Mariana Kaplan with us, who is the Chief of Systemic Autoimmunity, and we're going to ask her a few questions about progress and what we've seen in lupus research over the last 25 years. So thank you, Mariana, for joining us today. So talk to me first just a little bit about the event today. Why are we here? What did we hear from people?
So today marks the 25th anniversary of the lupus, not lupus clinical research really, because lupus clinical research at NIH has been going for half a century, but when we formally established a lupus natural history protocol that allows us to study in detail patients with lupus that are being seen at the NIH with the purpose of trying to understand what causes the disease, what causes many of the complications characteristic of the disease, and our goal really is to try to find new therapies that can improve the lives of patients with lupus.
That's great. So talk a little bit about just sort of some of the major milestones in research that we've seen, come out of the NIH program and even just in the lupus research field in general.
So I think significant advances have been made over the last 25 years, and part comes from the basic science side of trying to understand what happens to the immune system of lupus patients. And there have been many technological advances that allow us to better understand what happens to different types of cells that make the immune system, and really to start thinking that lupus is not just one disease and that there are many different ways by which people get what we call lupus. And this hopefully, I think, is getting us closer to what we call personalized medicine, which is trying to understand in each individual patient what is wrong with their immune system and then find better therapies for them that really target what abnormalities they specifically have. And something I want to emphasize, and that has been part of the work done here at the NIH, is that one of the main complications that lupus patients develop, but that continues to be a significant cause of morbidity and of mortality, is premature heart disease. And many lupus patients have a higher risk for heart attacks and for stroke. And there have been significant advances in understanding what is causing this. And I think we are now at the right stage that we could start trying to test different therapies that may hopefully mitigate this significant risk.
That's very exciting. And we also had, there were many people with lupus and patients who spoke today about their experience in participating in clinical trials here at NIH. And was there anything that struck you in listening to them? And just talk a little bit about the importance of the patient voice and their participation in clinical trials.
Yes, we couldn't do this with the patients' interest and really what really struck me today was the effort and the energy that they invest in participating in trials, and how this is not just for their own health, but many of them expressing how they're looking into future generations and helping other patients with lupus. And we're here to help lupus patients, but without their participation in trials, this would be impossible. And we have learned so much with the help of patients on what may be causing this condition and how we can move forward to prevent complications.
If a person with lupus was interested in any clinical trial, where do you recommend that they start?
If they are interested in participating at the NIH, so they can contact the NIH Clinical Center and specifically the NIH Lupus Clinical Research Group, and we are here to help, and we get in touch with the patient very quickly and try to see if this is the best fit for the patient to come here and be part of this group and participate in research.
That's great. And finally, what are you most hopeful for in terms of lupus research, and where do you think we might be in the next 25 years?
I think we have come a long way. As you know, just a few decades ago, lupus was considered a death sentence, and right now many lupus patients live fairly normal lives, and many have completely normal life expectancy, but there's still room for improvement in quality of life and in preventing certain complications. I think I envision that over the next 10 years there will be significant advances of better understanding these different types of lupus that we're talking about and what's the best medication for a specific patient. And I think this could make a significant difference both in response to treatment but also in preventing some of the complications that we're seeing.
That's great. That's very exciting news. And thank you, Dr. Kaplan, for joining us today. Thank you,
Thank you.
everyone.